Good evening to everyone out there who's looking to get some much needed information about the COVID-19 situation. Happy Friday. It's the weekend. Instead of going out partying, socializing, being that socialite you might be sometimes, instead, I hope that you're hunkering down as everyone is suggesting that we should be doing. And if you are doing so, congratulations. Hopefully, you don't have any traces of coronavirus anywhere around you, and you're just playing it safe and you're all prepared and you're ready to hunker down for at least the next few weeks. And so when I get started here, I'm just going to go over some of these notes that I came up with throughout the day. I did watch the press conference that the president delivered, and I do have some information below that entails some of that. But first of all, this is day 8 of the pandemic, and that's how many days it's been since the national emergency has been declared. And Trump, he announced that 148 different countries around the world are currently dealing with coronavirus. And I checked the map that Johns Hopkins has put out. It's very interactive. It breaks it down per country. If you zoom into the United States, you can zoom all the way into your state to find out how many people are affected where you live, if you live inside the United States. So it's a really good tool to use. I've been bringing it up for the last couple of videos on here. So, but it looks like even as far as Greenland even has a case there. It appeared on the map. And you get really small places like the U.S. Virgin Islands. I mean, St. Thomas is only 30 square miles, give or take. I spent a week in there on vacation for for a brief period of time. It was several years ago now, but it's a very small place. And if it's getting affected, if they're getting the effects of the virus, then it's definitely spreading far and wide. I know the Caribbean islands, most of them are tourist hotspots, so it's not a stretch of the imagination to think that coronavirus has made its way even as remote as these tiny islands. Even the island of Bermuda, which is way off the coast of North Carolina, they've got cases that they're dealing with. So this thing is spreading far and wide. It's all over the place. Nowhere is safe anymore unless you're in the comfort of your own home and you haven't gone out in a while. So it's crazy. It's everywhere. So and, with that being said, you must assume that everyone around you is infected, including yourself. Because once you get exposed to coronavirus, you can go 4+ days without showing any symptoms. And there have been cases of people who have come forward who were tested positive for coronavirus, but they did not feel any effects from coronavirus from start to finish. They didn't get a stuffy nose, no headache, no bone pain, no chills, no fever, no nothing. No stomach problems, vomiting, nothing at all to speak with. So just because you feel fine, it doesn't mean that you are fine. It might just be that you have either an incredibly good immune system or you're incredibly lucky that your immune system is keeping this thing suppressed and away from your symptoms. But I would certainly assume that you should you should assume that you are infected, and you should treat your house as if you are infected, especially if you're not the only one living there. If you are the only one that's there, I guess it really doesn't make any difference, especially if you don't have people coming to visit or anything. But so let's see here. So if you were in the public during the last 5 days, you should assume that you are infected, and definitely keep your hands clean and never touch anything in your house after you have touched your face. And if you do touch your face, wash your hands before you accidentally touch other things around the house. Now, if you've been in isolation for 5 days or more, I mean, I'm not a doctor and I didn't read this word for word, but from what I've been gathering and what I've been reading over the last week is that if you've been completely isolated for 5 days and you show no signs of any symptoms, it sounds like you're pretty good to go. It seems like that you wouldn't you wouldn't have contracted the coronavirus at that point. But again, once again, there are those rare cases of people who do contract it and they never show symptoms. And so I guess to be 100% safe, you should pretty much just isolate yourself completely, or keep your distance from others in your house, do the 6-foot rule. Definitely keep the hands clean, don't touch your face. And if you've been trapped in your house for 14 days, I believe that's what they're given the window for the amount of time that you have to take before you're no longer contagious anymore. So it really isn't just 5 days. It really technically should be 14 days in a minimum, if not possibly longer. All right. So, oh, and this is something I really wanted to stress. If you see your supply dwindling, if you've been washing your hands too much, and you start to see that you're starting to run low on liquid soap or even dish soap, if you've been using that, you can use bars of soap. A bar of soap will kill the virus, and that is what I've read. And I do have an article that I will pull up later that will show the different types of soaps that you can use. And I listed them also here too, but I'll read the information and I'll give the name of the website just so you can see for yourself where I pulled this information. So it includes soap, bars of soap. It can be natural soap, foamy soap. It can be liquid and handmade. The handmade soap, just your typical like made at home type of soap that you might just like make a bar of soap. You know, like they sell kits like that at Michael's and those craft stores, Hobby Lobby, and places like that. But any of those types of soap will kill the virus, according to at least the article that I read. Okay, so let's see. Moving on, tax deadline. It is now July 15th. So if you haven't done your taxes yet, if you're like me and you procrastinate till the last minute, you now have until July 15th, not April 15th of this year. I didn't read this anywhere, but I did read, just skipping to the next line, that the NBA will likely change its season permanently if they are able to return to gameplay this fall. So if the virus had kind of washed through and we've overcome the virus and we're getting into the fall season, the NBA may consider restarting the season that they had postponed earlier this year. And they're suggesting, or at least they're playing around with the idea that if they do that, then they may end up just having to flip their season schedule on a permanent basis. So it would be starting at a different time of year. I don't know what time that would be. I don't know if it might start in the early spring and just roll through the summer, maybe. I'm not sure what they were speaking about, but it seems like that they're talking about changing that. And with that said, the tax deadline being July 15th, and taxes, it has to be like an every year thing on the day every year because of taxes and quarterlies and your income information and all that. I wonder how difficult it would be for the IRS to take the tax deadline to July 15th and then looking forward to the next year, which would be April. That would be 9 months later. That we would have to file our taxes once again. It just sounds like it might be a very complicated process for us to file our taxes, get our tax refund checks, or pay your taxes in many circumstances, and then 9 months later having to do the same thing again. So I'm curious to see where that's going to play out over the next year, but obviously we have way more important things to consider. But I just thought that if you haven't heard about tax season and if you were still gearing up for April 15th, you can still file it on April 15th, but you have the extension till July 15th. So, we're definitely in no hurry as far as doing that. But they were encouraging people to file as soon as possible, those who are expecting to get a tax refund, just to have that money on hand, because obviously many people clearly need it like extremely bad. The ones who have been furloughed from their jobs at restaurants and shopping malls and retail places, and even like now we're seeing the airline industry, the cruise industry, and now it's getting into the auto manufacturing industry. So it's definitely starting to spread far and wide. So if you're expecting money back on your tax check, and if you think that this time next month you're going to be hurting for money, I mean, I would be filing that as soon as humanly possible. Okay, so this I found on the Washington Post, and it reported that President Trump's top economic advisor said that a rescue package that they're putting together could ultimately inject more than $2 trillion into the economy, which is a ton of money to put into the economy. And if this number continues to rise, it's going to lead to dramatic inflation. That's my opinion. The only thing the Washington Post reported was the first sentence that I read regarding President Trump and the $2 trillion package. I don't know if they call it a stimulus or whatever it is, but it's an economic package that they want to infuse into the economy to try to keep the gears turning. But I believe it's definitely going to lead to dramatic inflation. There's going to be a lot of people unemployed out there if they haven't gone to the point now where they are unemployed right now, and those people are going to have to receive aid. And rather than just receiving the aid and in return just sitting home twiddling their thumbs, just waiting to go back to work someday, instead I think the government needs to be extremely proactive and trying to get these people out to work in some way, shape, or form. And I've mentioned it before, rebuilding infrastructure, because work equals money. So if you provide a service, if you use yourself to do whatever it is you do, if you wait tables, or if you operate a cash register, or if you answer the phone all day, whatever it is that you're doing, your job is turning into money, essentially. Like, the company is getting paid for providing that service, and for just to and then in turn they give you money for you providing your service to them. I'm sure that they make more. Obviously they do. They make profits and things like that. But if you're looking at the government as a source of income for the short term, it would just be like a business just paying their employees for doing nothing. I mean, eventually that business is going to dry up. It's not going to continue to rake in cash if they have no employees that are working for them. So I think the same thing applies to the government. It absolutely, certainly applies to the government. So rebuilding the infrastructure, and by doing so, most of those jobs I would assume would be outdoors, or it might be in the environment where you would still be spaced 6 feet apart in many cases. So there shouldn't be much disease spread if they take this approach. So I can't remember which department in the government deals with like the highways and the bridges and infrastructure. I don't know if it's the Department of the Interior. I should know this. I'm sure I do. I just can't think of it right now, and I forgot to put that down here on my notes. But whichever department it is, I mean, hopefully they're interjecting that idea into this whole stimulus plan. I'm not necessarily saying that if anybody takes money from the government would be forced to work. I don't think that it really should be like that. But I think that people who opt not to work and they want to receive aid anyway from the government, it should be a minimum amount of money. Whereas like those who are saying, oh yeah, absolutely, just you can give me a shovel, or you can give me a laptop. I don't care what. I'll do whatever it is you need me to do. I think they should get the higher end of what the government would be prepared to offer them. So put them to work. The government can certainly do that. They've done that before. They did it during the Great Depression, and I'm sure there's quite a few other examples that the government has for helping people who were largely unemployed. So with that, I'll move on to the next topic. The top stories in an individual area, state, or country will likely spread to more areas quickly. The top stories in an individual area, state, or country will likely spread to more areas quickly. I'm not sure exactly what I meant by that. I may have to revisit that. But I do know that, okay, so the Army, I do know this. I did see this earlier, that President Trump has listened to Cuomo and offered to send the Army. Apparently Cuomo, I think it was in the media, it was in the press, like he was asking for military to come in and help the situation, and the mayor of New York City kept criticizing Trump because he wasn't doing so. I think the mayor's he's just PO'd because he keeps getting passed over because Trump's completely ignoring him, and he's going straight to the governor, because why not? I mean, why would you go to the mayor when the mayor doesn't really have the final say? Instead of wasting your time on a mayor, you can just go straight to the governor and have these dealings with him. So yes, so President Trump listened to the calls from the mayor of New York State, and apparently the mayor of New York City, and Army, the Army, the military Army. It's being sent into New York City. This isn't just the National Guard. This is the Army. So from what I heard, they are going to be using arenas or stadiums and like convention centers and places with wide open spaces, like generally public access type places like that. They're going to use those, and are going to set up hospital beds, cots, and stuff like that. They weren't very specific, but they were hinting toward that the Army's going to come in and try to set up a lot of that stuff for overflow when too many people get sick and the hospitals can't handle them anymore. So I think that's a bit of good news for sure, because I'm sure coronavirus is going to spread like crazy around New York City because it's so densely populated. And we do have stay-in orders in New York and New Jersey, California, Illinois, Connecticut, and yeah, probably more by now. So this I jotted down probably around 5 or 6 hours ago. So there might have been a few states by now that may have implemented these stay-in orders. So it's essentially you're not allowed to go anywhere unless you have a really good reason for going out, and they do include going to get food, getting medicine, some bare essentials. They'd be fine with that, but and it's essentially a very strong encouragement to stay inside. I don't know if they're fining people yet. There might be a couple of states where they might be rolling that out, or they already have. But if you live in any of those states, and frankly, if you live in any um, state for that matter, you can expect this to be happening pretty soon. So, and that actually draws me back up here to this part that I wasn't quite understanding at a moment's glance, just the way I worded it. So basically, like with these top stories that I'm showing here, um, you should expect these things to potentially be happening in your area sooner or later, because it's happening only in a few places now, but it seems like it's getting more and more widespread. Not the disease, but these actions that are being taken. So just because it's not happening in your area right now doesn't mean that a week from now you might start seeing Humvees cruising down your street. Who knows? But we'll just have to see how bad it gets in the coming days. And another one of these stories, France had impounded hundreds of thousands of face masks that were bound for the UK. And by the end of reading the article, France did admit that they screwed up. They didn't mean to do so, or at least the people who saw what was being shipped out of France, they kind of made a quick judgment call to stop that truck just to get clearance or something like that. Because I guess the who is it? The prime minister? I can't remember what they call it, president maybe. I believe it's Macron, if I'm not mistaken. I'm just reading so much information right now. I could have that screwed up, but yeah, I think it's President Macron. That sounds right to me. But he had put out an order saying that any virus related supplies that were leaving the country are hereby supposed to stay here. But I guess as far as the face masks going to the UK, apparently that was already prearranged or something. So they weren't supposed to stop it, but they did because they had that order from the president of France. And then they realized, no, this one doesn't count. You can let that one go. And I guess the mainstream news picked up that story, and the way they worded the title, it sounded really overblown. It sounded like France is so desperate now that they're taking face masks away from the UK that's rightfully the UK's, and they're just going to hang on to it and screw the UK. We got our own problems to deal with. But that got me wondering, that could start happening here. You might start seeing things that are being transported from one place to another, maybe not state by state exactly, but just supplies that are trying to get to certain places. But the places where these supplies are being manufactured, the local area might be in desperate need of those supplies, and they might insist that they keep those supplies there to help them out rather than dispersing these supplies across to other regions that don't affect them whatsoever. And right now, it would almost certainly start in the whole country by country, the international community to start with. So, for example, we really need ventilators. We're trying to get as many as we can, and the president is encouraging the state governments to try to buy from the open market if they can. But if not, they're still FEMA. They can still go through the government channels, and they're working as fast as they can to get the ventilators, the supply that they need. But he's encouraging them, if you know of a private vendor, if you know of anybody on the open market that your state can do business with, by all means, try to go through them, because you might get it quicker, because we're trying to get stuff to all 50 states here. I mean, nobody has a higher priority necessarily, but buying on the open market might guarantee delivery a little earlier. But the only problem I see with that is that, what was the number again? 148 countries around the world are dealing with this right now. So where you have countries that are producing ventilators, they may have a high population of people who need those ventilators. So when they're churning them out in a factory, they're probably not going to be shipping them over to us. They're going to be keeping them to save their own people. And to me, that doesn't make them a bad country at all, because I think we would be doing the exact same thing. I mean, if we're desperate to have supplies that will keep our citizens alive, I mean, if we're shipping them out to other countries, you know how terrible that would look, like from the eyes of the people that live here. those in their community who are making these supplies for their community, and just to see all those supplies being shipped off to other countries. So I don't know if that's far and wide yet, but as this thing keeps getting worse and worse, I would not be surprised if that starts happening. So it did happen actually with China when China was dealing with their coronavirus situation. There were shipments of N95 masks that were being shipped over here, and they were en route. They were already out on container ships heading over across the Pacific, and China ordered those ships to turn around so they can unload those masks. And I'm sure to us it was just a normal shipment because like 95+% of our N95 masks are made in China. And because there was a shipment heading over and the crisis got out of control so fast there, they ordered those ships turned around, whichever ones had those shipments of N95 masks. So it's already happened. It happened with China, insisting that they keep all their supplies inside their own country because they need it. So it looks kind of a scary type of future, in my opinion. I mean, there could be supplies we're incapable of making in this country that we desperately need. Antibiotics, for example. I mean, China makes, they said like 98 or 99% of all the antibiotics, and they make like 95% of all the generic medications across the board. So, I mean, I really think our dependence on China, once we're all done and through this, I think it's going to drastically change. Hopefully we will see this huge return of industry back into the United States after this, because this should be the wake-up call of all wake-up calls. Anyway, this one thing I really wanted to suggest. I don't want to bring up Nextdoor.com because it shows my personal information. So, because it's a very localized website where if you're not familiar with Nextdoor.com, you usually have to have an invite from somebody else in your neighborhood in order to join Nextdoor.com. And that's at least how I was brought to Nextdoor.com. There was a flyer that was left on my door that had a 6-digit code that I could use to log in with my local neighborhood. So I did so, and I got plugged in with my neighborhood and like 35 other surrounding neighborhoods. So it's more or less like the whole, not all of the city of Seminole, but a good part of it, like my area of it, covers everybody in my Nextdoor community that I have access to. So it looks a lot like Facebook. So people are posting all day long, especially now when everybody's hunkered indoors. So people are just, filling up the pages with information, people asking questions like, has anybody seen any toilet paper in the last hour? Does anybody know of some good restaurants that are doing takeout right now? So it's Q&A kind of stuff like that. And if I have a question, I can throw it out there to the community and they'd be really quick to answer it. So, so if you need help, or if you just want to stay in the current sphere of your local community, then you could get on Nextdoor.com and you can get a lot of information through them. And I'd mentioned on I think somewhere, I don't know if I put it on my notes, but Nextdoor, I mean, there's so many people in my area that are so eager to help the elderly or people who just can't afford to stock up on a couple of weeks worth of food, to the point where people are just posting out there, hey, if anybody needs help, I have a pickup truck. Just send me a message and I'll be over to help you with anything. People offering to like move furniture to help, like rearrange their space for food or for supplies and things like that. People just lending their elbow grease essentially. And then there's also people saying that hey, if like we would like to start donating food. Do you know anybody who really needs food? Be serious, and stuff like that. So, so if you are hard pressed to find food, every time you go to the store, it's either all gone, or if you just don't have very much money and you really are in desperate times right now, I would definitely, if you do have internet access, or if you know somebody who does, just try as best as you can to get on your local Nextdoor.com. I don't know how you can get on personally without being invited by somebody else. So there has to be a way how you can join your local neighborhood somehow by proving that you live there. I'm sure you don't have to have an invite. I'm sure there's other ways to join, but that's the only way that I know of to get on, because that's how I got on. But there's just tons of people on there just wanting to help, and it's a really good resource for those who are in need. And if you are one of the probable millions of Americans out there who are really nervous about what's going on and what the future might bring. I just thought I'd just encourage you and try to uplift you as much as I personally can by informing you of some things that we are very capable of doing. And just for starters, we do have the strongest currency on Earth, so that's something to be mindful of. And our GDP is also the largest on Earth, and the entire actually at this point it's the entire developed world, and most of the undeveloped world is overrun with this virus. And with us having such a massive GDP going into this and having the strongest economy on the planet, we're all in this together as an entire globe. Everybody's dealing with this, and for us to be as strong as we were going into this, it seems to reason to me at least that by the time all of this is taken care of and we've weathered through this storm, that we would almost certainly still come out just as far ahead as anybody else would have come out. I mean, the world's going to take a hit. The economy's going to take a hit. There's going to be a lot of damage done all over the place, but I think it's going to be as a collective whole. I don't think that individual countries are going to drop to dead last, on the economic scale by any means. I think that everything's going to definitely sink economically, but I think hopefully, my thought is that hopefully the whole world as a whole will all kind of sink down together to a certain level. So, I mean, just some encouragement, us being like the richest country, wealthiest country, most powerful country on earth going into this. I mean, we're very capable of handling things like this. We just need to find our American spirit. We have to find our patriotism. We have to dig that back up. Those who were around during 9/11, you know exactly what I'm talking about. The whole nation just rallied together. And I think we really need to be doing that again, and just know that we are strong enough to get through this. I know we've gotten very entitled over recent years. I blame my generation, the millennials, for acting very entitled. Not all of them, but a lot of them. Acting like that the world owes them everything, that they don't have to work very hard, if at all, for what they have. And they're about to get a rude awakening. I mean, people who were raised by the generation that grew up during the Depression, I'm sure that they know very well, like my grandparents. My grandparents' parents, they grew up in the Depression. So I'm sure if I talk to my grandma about this, about saving money and stuff, she knows exactly, she knows exactly how to explain the way things were through the mindset of somebody going through the Great Depression. So, I mean, and the ugly reality is that by the time this is all said and done, we might be looking at some level of a depression, but not just exclusively in our own country, but it's going to be a worldwide issue. So anyway, so moving on to the next point. So things, they will get bad for our way of life, but the U.S. should be able to pull through better than any country financially, just because we were so far ahead of everybody financially. I mean, we had been at least since World War II, if not well before that. I mean, we were such an industrialized country, even leaving the 1800s and going into the 1900s, the Industrial Revolution. I mean, our country exploded as a result of that. So we're very capable of getting through this, and no matter how bad it seems that it's going to get, I still think that we'll be back to 100%. I just hope that it's sooner rather than later. And we also have the best medical and disease research teams and development teams on the planet. So when it comes to our scientists and our engineers and infectious disease specialists and pharmaceutical research and the whole nine yards, I mean, we've got the best of the best in the world. And our country is the one who develops most of all of this, all these great pharmaceuticals, and the rest of the world just kind of just takes the end product and makes a generic form of it. And, we don't really get a whole lot of credit where credit should be due. But I think in the face of this situation, we've got the best talent in the world that's going to be fighting this, and the best talent happens to be in our country. So that should be uplifting to some degree, hopefully. It was to me, me reading that, that is. But we must not let the virus infect most of the population, though. So the faster a country can get their virus issue under control, the faster and the better that economy can recover. So if we drag our feet on this, and if it takes too long for us to recover, and other countries are getting their act together and they're getting their numbers down, well, then there might be a little bit of economic offset. I mean, if we're still struggling, 6 months, 9 months after a lot of other countries had recovered from it, well, then we might start to see problems. So, but what we have to do is just keep that mentality that we have to stay inside, keep our hands clean, 6 foot rule. Don't get too close to anybody. Don't breathe in anybody's direction because you could be infected without knowing that. If we as individuals can keep those points in mind, then we can get rid of this virus a lot sooner than otherwise. If people, like a lot of millennials, just going out and they're mad because all the places are closed because they want to go out and party right now. It's absolutely insane. It's ridiculous. So, and this is it's a natural disaster it's affecting the whole world. And this is definitely not an economic disaster like we saw in 1929 as well as 2008. I know the stock market crashed in 1987. Not really sure how badly people suffered as a result of that. I mean, I could be wrong, but I don't think it was that bad, at least not compared to 1929 or 2008. So there is that also. So just, like with it being a natural disaster, it's a whole different animal from an economic disaster. I mean, we're not looking at like severe depression type situations, I don't think, at least not right now. I mean, we'll just have to see as time goes on. And we have to use our sense of unity and patriotism like we did during 9/11. If you help your neighbors, or you should help out your neighbors, but you should also be safe. So if you give to other people, if you want to give them like a gallon of water, or maybe give them a bottle of sanitizer if you have enough to spare, or just give them anything. The best thing that you can do, just in case for their sake, in case you might be infected and you don't know, and you could just be asymptomatic. So you might feel perfectly fine, but you might have had coronavirus for 10 days. So like you're in the thick of it, but your immune system's so awesome that you just don't have any symptoms. So with that being said, if you're giving to other people, giving goods to other people, or lending a hand that would lead to whatever them touching would be something that you would touch as well, you should definitely wash your hands first, and then you should sanitize any goods that you hand off to another person. And just then, once you wash your hands and then once you sanitize whatever it is you're giving to them, you can be assured and you can have the peace of mind that whatever you could potentially have, you're not going to be giving to them. So this shouldn't be just because we're not, I mean, at least not where I live in Tampa Bay. We're not like on a forced lockdown or anything, but we're strongly encouraged to stay at home. But this doesn't necessarily mean every person for themselves. That I'm just going to stay where I'm at and I'm not going to help anybody, no matter who's crying for help. It's not really like that. I mean, there should still be a strong sense of community. It's just that when you have an opportunity to help somebody, you have to take that extra precaution to not have direct contact with them, and they should have the same precautions. You both have to assume that you both are infected, because at this point, anybody can be infected. So that's definitely something that you really should take seriously. And with that said, I'm going to get into the press conference from President Trump, which did take place today. So if you don't have time to watch it, if it's just not your thing, you just don't like, following press conferences because it's boring or whatever, if you'd rather listen to me talk than the president and those other fine experts that were up there on the stage, then I've got some things that I can share with you that I did hear. I did take notes as I was listening to it, and this is the information I came up with. But before I do so, my mouth is getting dry, so I'm going to go grab a drink real quick, and I will be right back. Okay, I am back. Am I back? Yes, I am back. And I'm going to get right into this press conference information here. So this was, I think the press conference gathered around 12:30 in the afternoon. I didn't watch it live, but I did catch it in the afternoon. So I was a couple hours behind the actual conference, but I think it was like around 12:30. And I believe they've been fairly consistent with that. They're trying to do as close to in the middle of the day as they can. So with that being said, anyway, I'll just go ahead and get into these points here. So he did start out, well, he didn't start out by saying this, but this is where I kind of started taking notes just a few minutes after he started doing the press conference, after he did his thanks. Thank you all for being here. Thank you everybody behind me, and the the initial greeting part of the conference, he did state that alcohol companies, and he mentioned Arkansas. I think he said Kentucky was another state. There's a couple of states, and he didn't name the actual companies, but he said that there are alcohol companies out there that are making hand sanitizer. And he's not using that act. I can't remember what the name of that act was. Stafford Act, I think it was. And if it is the Stafford Act, it's the act where the government can essentially take over companies to produce goods that will help the people. And there's, I think he said that they are looking at doing that, like with the N95 masks. I think they did it. They did use that act to start doing that. But these alcohol companies that are making hand sanitizer, they're doing this on their own. So he commended them for taking the initiative to actually start producing something that's going to greatly help the American people. So that's really awesome. So I don't know who it is. He didn't say. I know. I don't believe he said Tennessee. He might have said that because, you know, one can get Tennessee and Kentucky mixed up. But if it's Jack Daniels, I don't know because they didn't say. But maybe a couple of months from now, you might start seeing Jack Daniels hand sanitizer on the shelves. That might be interesting. And also, they've ordered hundreds of millions of N95 masks for production. And these will primarily go to medical personnel. And FEMA is heading up this operation, and they have in total a $500 million order, which includes hundreds of millions of these masks. So you might wonder, why are they using hundreds of millions just for medical personnel? Well, it's not only to them, but they have the highest priority because they have not only do they have the most exposure to the disease, they're also the highest qualified people that we have to deal with this thing in hospitals. So if all the doctors and nurses get sick, who's going to be left to take care of everybody? So they absolutely should get first dibs on the masks. And then following would be people in hospitals who go to a hospital, they'll be given a mask. So there's that. So there's lots and lots of them that are rolling out right now. So hopefully very soon we'll start seeing it all over the country, and you won't hear about shortages anywhere because there are still some spots where they're running out of supplies. But it's a very complicated system, folks. I mean, if you're trying to, like the press, the press keeps criticizing the president because they're getting information from just random doctor in this state saying that I work in the hospital and I don't have a mask and we have no supplies. I can't protect myself. What the heck is going on? Yeah, you might get a case here and a case there, but given the infrastructure, the complexity of our country, the physical complexity of our country, having all 50 states and each state has a wide range of counties for the most part. I mean, it breaks down to a very detailed system, and you've got FEMA who's working with every single state in the country. But it's not just a matter of just simply dropping off some masks at their front door. I mean, there's a lot of things involved in that supply chain. I mean, they have to produce all the masks, which it sounds like that they've produced a large amount of this already. But then they have to go through all the shipping channels. So I'm sure that's a logistical nightmare too, having to last minute contract a lot of truckers and trucking companies to send all this stuff in. So I don't think it's just a matter of you know, them being lazy or anything. I think that these plants where they're producing these masks, they probably have a mile-long convoy of semis just waiting in line to just get their semi loaded up. I don't know that for sure. I'm just speculating, but I'm sure that there's really good reason why there might be a doctor somewhere in the country that doesn't have a mask, and it's because the fast response to what's going on and the amount of stuff that's happening in the supply chain and the delivery chain. It's a very complicated system, and they've only had this thing going for a matter of days. So, you know, it's falling into place. We did catch it quick. It's just this virus is extremely fast, and it's spreading way more rapidly than we were prepared for, because initially when China was dealing with it, we weren't being told exactly what was going on. Instead, we were just getting leaked information here and there. So if China had been transparent since back in November and maybe as early as October, then we would have been able to be mass producing these N95 masks months ago in anticipation of what we were going to end up dealing with. But no, they kept us in the dark, and we didn't really know the gravity of this virus that we were going to deal with. And now we're here with hospitals that are running low on supply, but they are assuring us there's hundreds of millions on the way. So they will be getting into the hospitals in the next coming days. They didn't give us an exact day timeline, but they did say in the coming days. I believe that's the wording that they used. So if you live in an area like that, it's something that should be a ray of hope for you, that they will be showing up at any time. Let's see. So we are currently on day 6 out of 15 days since the president's guidelines for curbing the infection, which includes staying 6 feet away from others, 10 people in a group at the most. It was a 15-day plan where it wasn't like an executive order exactly. It's just like a very strong recommendation, and that's kind of the textbook guidelines that everybody in all 50 states, whether if you're in a rural community or if you're in the middle of New York City, everybody should be abiding by these rules. And they made this public 6 days ago. So obviously it's been 6 days since that's happened. And they said that they want to see where we're at in 15 days. And they said that if everybody follows that, then by the time we hit 15 days, we should be seeing the spread of the virus slowing down, hopefully to a stop. And then in the next coming days after that, it'll start to gradually go down. But that's if everybody's listening. That's if everybody's doing this. I don't have a lot of faith in millennials. They were pleading with millennials back on day 1 and day 2 to please take this advice. Please help us. Your generation is the one that's most outgoing right now, and your generation is going to be pivotal in slowing down this virus. And as a millennial, and knowing a lot of millennials, I don't have much faith in my generation. I truly don't. I really hope that they get their act together. I've gotten full on OCD ever since this thing started blowing up last week. But I hope that all other millennials out there, which I already know because there's a few that I work with that are not taking this seriously. They're asking around the workplace. They're like, hey, do you know of any other places that are open? Like everything's closed around where I live. Like a place where I can go drink and have some chicken wings. Like, are you freaking kidding me? No, of course not. Everybody's closing. What the hell? So anyway, sorry, that was probably really loud. It was right up against the mic. My apologies. Let's see. So, moving on. So, a staff member for Vice President Pence was tested positive for the coronavirus. Now, he was tested positive, if I'm not mistaken. It was on Sunday, I think they said. I know I put the note that he's neither Pence or Trump has had contact with the staff member since before Monday. It was on Monday. He must have been tested on Monday. But they've assured the public that neither the president or the vice president had direct contact with this individual prior to Monday. And apparently Monday was the day that he tested, or no. Hold on. I think he was tested today. I think it was like breaking news, or maybe he was tested yesterday, and the breaking news came out was that he was tested positive for the virus, but because of the whole 4-day thing or 5-day thing that you can have the virus before you start getting sick, I believe that's what they were talking about. So essentially, if you're confused about how I'm wording this, the takeaway is that President Trump and Vice President Pence did not make contact with this staff member prior to Monday, which means that they would have not contracted coronavirus from him. So they are in the clear. But just to be safe, Vice President Pence says that he is going to get a test this evening with his wife, because his wife must have been with him when that staff member was present. So, but Trump didn't say he was going to get one. Somebody did ask if he was going to get another one, and he's like, well, I just got one. I feel fine. I feel okay. Now, if he had direct contact with this person, just because you just got a test doesn't mean that you're immune to it. So I don't think he worded that very well, because you could be tested for the virus tonight, and then tomorrow they tell you that you're negative, but then that afternoon you go to the store and you touch something, you touch your face, and now you got it. And then a few days later, you're going to have full-blown symptoms. So just because you're tested negative for it doesn't mean that you're not going to have it. You can catch it 5 minutes after you get that test. So I don't think he handled that question perfectly, but he says he's not getting a test. He says his doctors don't think he should get a second one, that he's fine. The window is wide open. It's wide enough to where he wouldn't have gotten the virus from that person, that staff member. So So yeah, so there's that. And there are currently 91. There are 91 public health labs that are currently running, and that includes the territories of Guam and Puerto Rico. And that also does not include the 15,000 plus hospital labs that are around the country. Because, I mean, me having worked in 3 separate major hospitals in the United States, 2 separate states, I did 2 major hospitals here in Tampa Bay, and I did another one out of state for a couple of years. They have laboratory departments in these hospitals, large and small. It doesn't even have to be a major hospital. It doesn't have to be a trauma hospital. Even a small, like a small town hospital, I'm sure has lab departments, or a lab department, I should say. But these departments are not included in this number, obviously, because we have way more than 91 hospitals. But they're saying that yes, we do have 91 public health facilities that are running large amounts of tests and just churning out these results. They didn't say how many, but I assume daily it's probably by the thousands. But those who go to the hospital who think they're infected, they can get swabbed there, and they're not going to send that swab in that hospital off to one of those 91 facilities. Instead, the hospital is individually capable of running the test and seeing if they are positive for coronavirus. So anybody who is unfortunate enough to have to go to the hospital, you should be able to get your test while you're there at the hospital. I think the only way that you wouldn't get the test immediately or as soon as they get the result might be because the hospital could be overwhelmed. So they might be swabbing you maybe in the lobby or right out front or something. And they might say, hey, we'll call you or check your email or however it is that they're going to communicate to you, whether if you're infected or not. But I'm not too familiar with that process. There hasn't been a lot of information that I've seen as to how that would get handled. Actually, I might make a note of that for tomorrow. I might talk about if you are infected and if you do go to the hospital, how do you expect to get your results? I mean, that would be something everybody should definitely know. Okay, so as of March the 21st, there's been 195,000 tests that have been done across the United States. That was as of today. I'm sure that was this morning's numbers. So they're approaching 200,000 tests that have been done. So they are churning them out, and I'm sure the number is going to get bigger and bigger as time goes on. I'm just reading what they were saying in the press conference. They did talk about local drive up and walk up facilities or testing sites, and those are state managed, and they're executed by the local officials. So this isn't something that's being done by the CDC specifically. The CDC is kind of tasked with delivering all the supplies to the states, and from there the states manage these walk up and drive up testing sites. So I'm not sure how relevant that would be to you or how much you need to know that, but it's there. Let's see. And they are strongly asking, they're borderline pleading really, to put off any elective surgeries that you have scheduled, any procedures, anything that you're going to have done that you don't need to have done immediately. If you got some sort of an issue where your life is uncomfortable, but you can get through it just fine for another year, or if you're going for like cosmetic surgery or anything like that. I mean, the hospital will probably end up canceling that just because that's so unnecessary, really. I mean, especially in this situation. But they're asking if you can put off any procedures for a period of time. They're pleading pretty much. I mean, I'm using that word, not them, but they're really strongly asking that you reschedule that because they do use a lot of supplies for procedures. They're going to use the gowns, they're going to use masks, they're going to use bed sheets and other equipment for some surgeries. Even simple procedures, they'll use a ventilator while you're under anesthesia. So all these supplies that they're using for you, they could be better used fighting the virus with people who are infected with COVID-19. So definitely do that if at all possible, please. I definitely agree with that. Let's see. Okay, so what they're doing, so this is pertaining to, let's see. So if you're an organization who is giving out supplies, Like if you're a private company, for example, and you're like, well, I own this factory. I mean, we don't make masks, but we have all the material to do it. I mean, we certainly have the equipment. We just have to re-engineer our assembly line. We have to re-engineer some things, but we got the engineers to do this. We could be churning these things out maybe within a week or so. They're they're certainly asking any industry in the United States to take the initiative to make anything you can that's going to help in this effort. But they're strongly encouraging you to use the FEMA procedures that are in place if you're going to go ahead and do so. So if you work in a workplace like that, or if you own a factory, or if you own any kind of facility where you would be able to make supplies that could benefit in any way, even if you make hand sanitizer, whatever it is that you can make, they're asking that you can somehow, they didn't say how exactly, but they said you should coordinate with FEMA, maybe going to their website or doing what you can, be proactive and try to get those procedures that they suggest that you follow, as far as maybe not producing it necessarily, but maybe how you can get it out into the places that need those products the most. They also said that if the states, the individual states, if they can get supplies through the open market, which I mentioned earlier with ventilators, to certainly do so. Buy private if you can. But if they're having no luck doing so, or if it's just not able to get done, they can request help through FEMA in your state. So even if you're in a local community, let's say that you're a mayor of a small town in like Nebraska or Wyoming or something, they're saying that if you haven't heard this yet, that you can go through FEMA, which you probably should know if you're a public official. But just in case, they wanted to reiterate that, in case anybody out there who's trying to quarterback this situation in their community, you can go to FEMA and you can ask for help. So you don't even have to be, running an official town. Maybe if you just have like we don't really call them villages here, but if you have like a small community out in the sticks somewhere, and you don't really have any elected officials that are looking at you or helping you specifically, you can still go through FEMA and request supplies or information at the very least on how you can get the help that you're going to be asking for. And this will be helping out a lot of people. Unfortunately, not the economy as a whole, but they are saying, let's see, Ben Carson, he's the secretary for Housing and Urban Development. I think I got that right, HUD or something like that. Yeah, HUD, Housing and Urban Development. He has, by the approval of the president, he has stopped the process of foreclosures and evictions right now. So there is a delay in effect, and I don't know if he gave a date in this press conference. I didn't take it down, but I have heard this previously, and I've talked about this previously. And if memory serves, and don't quote me on this exactly, but I believe it's been extended until April 30th. The first time I heard about it, I want to say it was April 15th. That's what they were extending it to, but now I believe it's been pushed back to April 30th. So if you've been furloughed from your job, or if you've been let go and you have to make a mortgage payment, or if you have to make a rent payment and you just absolutely cannot find any way to get enough money together to stay current in your rent, then I would definitely suggest that you go online and you look this up specifically, because I'm sure there's tons of information online that explains that, including the deadline, or including how long that they've delayed this for. Because right now I'm saying April 30th. I may have missed something today, and maybe they've even pushed it back to May or something for all I know. Or maybe it is April 15th, and I just thought it was April 30th. So don't take my word for it. I would definitely go out and look if this is going to affect you personally. Excuse me. So let's see here. And by the way, the reason that they're doing that, just to read through my notes, they're doing that to help everyone stay inside and recover from the virus, to quarantine themselves and to isolate. If anything, just keep yourself isolated from the public. So because your health is more important than your rent payment, it does drastically affect the economy if hundreds of thousands, if not millions of people don't pay their rent, but at least they're still alive. At least they still have a place to live in. We can worry about that rent issue later on. I mean, human life is more important than rent payments and the economy, really. Survival is that's what's most important. Okay, so let's see here. So what they're trying to do, they're trying to put together a $2 trillion package. I think I touched on that earlier, to keep companies and their workers together, because otherwise companies would possibly end up breaking apart, and it may take years to get the economy back to normal. So they're trying to infuse a lot of money into the economy, not just to keep the economy stable as a whole, but they're trying to infuse a lot of that into companies, not trying to give them free money, but just trying to keep them viable, trying to keep them from going bankrupt. Because if they go bankrupt and if they dissolve and disappear, it could take years before somebody could gather enough capital to replace that company and rise out of the ashes, so to speak. Let's see here. So let's see here. New regulation. It allows hospitals to buy and use N95 masks until 2024. And previous to this situation, N95 masks were primarily used in the construction industry and other factories and other industries. If there's an N95, if it's an N95 certified mask, but it's a mask that you would see painters using, or people who put up plaster, or people who just work in construction, or just name the trade. These masks, as long as they're N95 certified, they can be used in the hospitals. So and that leads me to this next point. The White House is asking all businesses to inventory any masks that you might have in your company. If you have any stockpiles, if you have any surplus, especially if your company is not running right now, and if you have a stockpile of masks, no matter how big or small, if you have 100 of them or if you have 20,000 plus, what they want you to do, they want you to donate those. You can donate them to any of your local hospitals. And they say, by their quote, you would be doing a great service to your country if you can donate those masks. So, I mean, you're not going to get reimbursed by the government probably, but you could be potentially saving lots and lots of lives if you allow those local hospitals to use your supply. And they're saying that it could be N95 masks that look like the masks, again, like I said, what painters use and things like that. Even those masks they're at this point, they're good enough and they're effective enough that that anybody in the hospital can use them, whether if it's doctors or patients, nurses, whoever. So definitely check your inventory if you are a business owner, and if you do deal with N95 masks, especially those like small painting companies. I mean, I'm not sure really if they would have a stockpile at this point, because when I was first preparing for this situation, one of those items on my list were N95 masks, and I thought I was going to be clever and head down to Home Depot and be like, well, hell, I'll just go down there and just buy a couple of painter's masks. I mean, most people are going to be looking for like hospital N95 masks, right? Well, no. When I went down there, and again, this is weeks ago. This was like back in like around Valentine's Day. I went down there to Home Depot and they were completely gone. So I would assume that if you have a small painting business, you're probably really struggling to find masks just to use to stay in business. So I think this is pertaining not to the small mom and pop businesses, but more toward those larger larger operations where you've got hundreds of employees. Anything you can spare, anything at all. So, and let's see. So yeah, so the president was asked by the news media, the ones that are not so great, why it took so long to have such a large supply of masks, since the United States is the wealthiest country in the world. And the president said that past administrations absolutely did not make it easy to ramp up this level of supplies. And with that being said, he touched on a couple of things, but that was the gist of it. I mean, it was definitely a loaded question. It was just a poke at the president. Instead of asking a question that would really benefit people who are watching it, instead he's just trying to attack his presidency. And it's like, well, why did it take this long? Why? Instead, he should be asking other important questions. He had to take a jab at the president. But in my opinion, I mean, look at the shipping industry to China 30 plus years ago. That killed our ability to switch industry to emergency production. And it's the emergency production we were capable of doing just exactly what we had just after World War II. And from what I remember in high school, and let's see, I was in high school from 1999 through 2003. And one of my teachers, she had a spouse who worked at Allison's Motors. I think it was called Allison's Motors, Allison Engines, whatever. But apparently they build engines for Rolls Royces. But they used to, it doesn't sound like they probably do anymore, but at least once upon a time, they would do monthly drills. Every month they would do this drill. And the drill that they would do, they would have to recalibrate all their machines from making engines for cars to making engines for airplanes. And every month they did the drill. They wanted to stay on top of their conversion. So as quickly as humanly possible, they can go from making car engines to making plane engines to start churning them out like it's wartime all over again. And it blew my mind, just the numbers that she told me, or told the class really, that when they would do those drills, they were always shooting for 2 minutes flat. That was the record. That's the company record. And every time they do the drill, they were almost exactly 2 minutes flat. So for them to be, if you can imagine an assembly line where car engines are being manufactured, and then all of a sudden they stop production, and then 2 minutes go by, and then production starts to start up again, then you're going to start seeing airplane engines starting to come out the other end. It's just crazy, 2 minutes. And another thing that stuck with me over the years that she mentioned, she said that she asked if we could guess the second fastest country in the world who is capable of changing their machines from making consumer goods to making wartime goods. And we were like, I don't know, Japan probably, or maybe like Germany, UK, I don't know. But she was like, no, it's Russia. Russia, I mean, again, this is coming from a teacher back in like 2002, 2003. So the information, I'm not trying to give you an expert's guide toward this information or for this information, but she said that Russia was the second fastest behind the United States, that went from making consumer goods to making military goods. And the United States can get it done within 2 to 5 minutes from most factories. And Russia would take them about 2 weeks to calibrate all their machinery to get their factories making consumer products to making military products. So I thought that was incredible. So we lost that initiative. We lost that ingenuity. We lost that patriotism. We were on our toes after World War II, and we remained that way all the way throughout the Cold War. And then once that fell, and then after all these jobs started shipping over to China once the Cold War fell for whatever reason, NAFTA was passed by Bill Clinton back in the 90s, and our dependency for other countries just skyrocketed. Just all this outsourcing, it was just insane. But before that, when the Cold War was still hot and heavy, I mean, we were making tons of stuff here in the United States. I mean, I'm sure the vast majority of the stuff that we used was made in the USA. And if you can remember, like if you could probably go on eBay and buy a toaster that was made in the 1950s, that sucker would probably still be working 50 years from now. I mean, the way that they built stuff back then was so strong and so built to last, that they built stuff that would last forever. And then we get into this age where everything's made in China, or everything's made super cheaply, and maybe somewhat of a conspiracy, but a lot of these factories, they built this crappy, cheap products, not only because it cost them less, but if you buy one of those cheap products, they're only going to last a year or two. They're going to break, and then you're going to have to buy another one. And the same thing repeats year after year. Whereas when we were making American and buying American, we had these really strong products that would last 25, 30, 40, 50 plus years. You wouldn't have to replace it. Once you bought it, that's what you had. But I really hope that after this whole situation is over with, I hope we get back to that American spirit, our industrialism that we had so strongly in the late 1800s, the 1900s, early to mid 1900s. I mean, we had such a strong production machine in this country. It was insanely amazing how strong we were as a country, especially in terms of industry. And we kind of just thrown it all out to everybody else who wants to take it just so we can get cheaper goods. It's ridiculous. So, I mean, I think we're going to see somewhat of a revolution after the world recovers from this. And I think we're going to be bringing tons of stuff back home, and we're going to see the quality of goods just getting exponentially much, much better. Maybe more expensive, but you know what? After all this is said and done, with the millions of people that are probably going to be on unemployment for a while or not getting any money at all, depression-like times, I think that once the country completely recovers and we're all finally back to work again, I think people are going to have a whole different perspective as to how they should be spending their money. And I hope that everybody will save, 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 because if everybody had that mentality of those who were raised during the Great Depression, if we all knew how they were brought up and we understood that, I think we could get this through this situation much better. I really do. But what do I know? I'm just some stupid millennial, I guess. No, I'm certainly not stupid, but I am a millennial. That is something I am guilty of, unfortunately. So, okay. Let's see where I'm at here. My apologies. I know sometimes I go off on rants. Okay, so, excuse me. Let's see, skipping down a little bit. Oh, this is cool. The president is planning on sending cruise liners to help against the virus. He wasn't specific. He mentioned New York City and Los Angeles. And he was talking about the medical ships, the naval medical ships that he's sending. They're floating hospitals. I mean, like they have a 10 operating rooms or 12 operating rooms, something like 1,000 different beds that they could fit on that ship. It's incredible what they have on these ships. But they're sending. It sounded like they're sending 2 to New York, but I think they had 3 that they were able to send out. But one's going to LA, one's going to New York, and I think they're going to send the 3rd up to New York. But in addition to that, like in the same paragraph, so to speak, he was talking about cruise liners being involved. And this is exactly what we should be doing, because the cruise line industry is being threatened with bankruptcy because nobody's going to be taking a cruise now. So instead of those cruise ships just sitting there doing nothing but collecting dust, oh man, excuse me, the United States government can actually use those and actually make them do a whole lot of good, whether if it's dealing with coronavirus patients or dealing maybe even with the homeless population that hasn't contracted it yet, and they house them until we can deal with this situation. Whatever the case may be, if the government is using those ships, the government's going to be paying the cruise line industries for using them, of course. So it's kind of a win-win situation. So now we don't have to bail them out like we did with the big banks back in 08 and 09. And the same could go with the airline industry. I mean, that might be a little harder to figure out because we have a lot of planes in our military arsenal, I would think. But maybe they could instead, like grounded planes, the United States government might be able to procure some of those and actually send them out abroad and pick up some of our Americans who are stranded in other countries. Because one of the questions that was asked by a reporter was involving an American who's stuck in Morocco, and they're desperate to get back home. They're trying to get back home, but they can't because there's no flights leaving Morocco bound for the United States, period. There's just not enough people that are, I guess, needing to go back to the United States. And I'm not sure if it was the president or if it was Vice President Pence or who answered that question, but they were saying that they're working on that. They've been working on that for a few days now. They're talking with not the airline industry specifically, but they're talking to like the private travel industry, like with like commercial jetliners and like Learjet companies or whatever, and they're trying to send some of those over to those countries where there's just a handful of Americans. But they did say that if you know anybody who's in a country where they're not flying into the United States, or if you are one of those people, you've got to reach out to the American embassy in that country and let them know you're there, let them know your situation, give them all the details that they're asking for. That way, if there's any list that they're putting together of Americans who need to be taken out of that country and brought back home, that you can be sure that you're on that list. So you got to reach out to your embassy if you are in that situation, or if you know somebody who is in that situation and they haven't received that information yet. And that was just discussed today. So definitely reach out to the embassy because they will be able to help you. Okay, so that pretty much wraps up the press conference. So I got through all the points for that, and that's finished. That's all that I got for it. They did talk about a lot more information. I took down notes, whenever I felt that it was important enough to discuss, but that's not to say that I didn't skip anything that was also really important. So if you want, you can definitely listen to it, and you might learn some additional information, but if that's not your thing, if you just don't like to listen to it, if you'd rather me tell you what they were talking about, then, well, there you go. It is the weekend, So I wasn't at work today all day, so I was able to watch it and take notes. I try to watch it every day. I think I've only missed a couple of them so far since last week, but it's just time consuming taking notes because I have to pause, take notes, and play, and I would rather just pull up news articles and just go through those also. But I try to at least listen to that, and whenever I can just bounce off additional information off of articles that I'm going through and say, hey, oh yeah, by the way, in the press conference today, they actually discussed this very thing. This is what they were talking about. Like I can infuse what I've listened to and learned from those press conferences. But I like sticking with the articles because I like reading them. That way, anybody who's watching this can read along with me. And it's right there. So you're reading what I'm reading. So as opposed to this, where I'm just taking notes, and I don't take notes absolutely perfectly. I'm not a machine. So there might be a couple of inconsistencies in here, but I think for the most part I got it pretty well. So anyway, all right. Let me just one sec. Take a drag from the vape stick. You know what? To be honest, I really shouldn't be doing this because, well, I mean, if I do, knock on wood. My God, knock on wood. If I'm really going there, um, vaping is probably not a very good idea in this climate right now because they're saying that if you have any issues with your lungs, you're going to deal with coronavirus very harshly. And I mean, I'm glad at least I'm not a smoker. I mean, anybody out there who smokes cigarettes on a daily basis, I mean, they haven't come out with any results, any studies, like nothing to the fact because coronavirus is so brand new right now. But if you're a long-term smoker and if you catch coronavirus, I mean, I'm no expert, I'm no medical professional, but to me that sounds like a world of hell. And I'm vaping, and I think I'm gonna have it bad vaping. And I mean, I quit smoking back in 2015, so and that was actually on March 15th of 2015. So that it's been 5 years. So since I quit, and my sense of smell is outstanding again. My sense of taste, I'm sure, is much better than it was. I can breathe much better than I used to, despite the fact that I do vape. Although I don't vape while I'm at work because I'm stuck in work all day. So I do go 8 hours without vaping. But I'm one of those types that as soon as I crawl out of bed, I have to take one drag. But anyway, enough with that. So I did want to mention this. If you do like things like the press conference, and if you do like political drama more specifically, I'm not going to get into this because this doesn't have anything to do with the virus specifically, like in the way that it could affect you personally. But I did just want to mention, because this is pretty big in the news right now, that there are U.S. senators that used inside trading information to cash out their personal stocks for millions of dollars. And this happened just last month, right before the economy took a hit, like not even a week before the economy started to tank. And if you wanted to look up that information, and I'll go ahead and pull that up real quick just to show you what I showed up or what I got on Google. I'm not saying you should use Google. That's just what I use. And that's what, like I think like 80% of all the searches done on the internet is used through Google and or YouTube. But I went for senators cash out, and it brought up a number of articles. Not as fairly balanced as I would like, but they were there nonetheless. Nonetheless. So senators cash out, and it brought up this information. But you might see the names of a couple of senators, but I know Dianne Feinstein was one of them. There were a couple of others that were named. There was one senator in particular that sounds like he might get charged. Like he might lose his job, and he might actually get indicted for doing this. But there's been a few senators that caught wind before the rest of the country did. And the wind that they caught was that the economy was about to take a quick downfall because of what's to come in the next coming days. And the Senate usually gets information before the public does, just so they can prepare bills and they can prepare information and get ahead of it as best they can before the storm happens. But sounds like a few of these senators, they heard about the upcoming economic woes, and they used that information as an opportunity to liquidate their stocks before we knew that the stock market was going to tank. So that's a huge no-no. It's insider trading, clear. I mean, that's textbook insider trading. So it sounds like there's some politicians in hot water. So if you are interested in that thing, if that's your bag, political drama, look into that. And if you feel like it, if you like typing comments, then leave a comment in this video section and let me know what you found from that, because I'm definitely into political drama too, but I don't like, I mean, whenever I can, I know sometimes I kind of blur the lines a little bit, but I like to try to stick to what's really happening with everybody, as opposed to whether if it's opinionated or whether if it's just, you know, straight up drama. I don't like to get into all that, especially doing these videos in particular, but on my off time, you know, I get into that, but these days I'm all day just focused on coronavirus, and whatever I find, I make the video and I just show you what I find. And this was just a random thought that I just came up with today. Is the railing, or like the train industry, is it going to ramp up its value in place, and companies like CSX, which is owned by Warren Buffett, Berkshire Hathaway, although CSX has its own separate stock. I did a brief glance at it. I think it was like $35, $40, something like that. That's what it's trading for. But I know Warren Buffett, a lot of, or like his umbrella company, Berkshire Hathaway. If you want one share of that, you're gonna have to fork over like $150,000 for one single share. Or no, it's like $300,000. It's an insane amount of money. But CSX is owned by Warren Buffett, but it is traded separately on the open market. And another one's BNSF. I was trying to think of railing companies, but that's all I came up with as I was typing this. But will they ramp up their value due to massive supply needs? Because I saw a video earlier, which I did post on my yesterday video, or I included it in it, and that was a train that was just rocketing down the tracks that was just filled with Humvees and army trucks, or military vehicles. So I mean, I'm sure CSX, BNSF, or whoever it is, Northern Pacific Railways, I think that's another one. I'm sure that they are getting paid for doing so. I mean, it's not just the trucking industry that's going to get a lot of value out of this situation by shipping supplies around. I'm sure the rail industry is going to see a giant uptick. But when I was completing that thought, and when I went to check CSX stock, assuming that it would be in the green, it was actually in the red. So I could be completely wrong on that, but it just sounds to me like anything that has to do with shipping, getting things to where they need to go very quickly, it just sounds like it's not a losable market to be involved in right now. I mean, especially like UPS and FedEx, people ordering online like crazy, people stuck inside their online shopping. I know Amazon, you'll be hard pressed to find something that they'll ship, because they came out the other day and said that they're not shipping anything that's non-essential. At least what I read, they were vague with it. They didn't give any examples. I just kind of had to insert here kind of thing, such as medicine or food, things that you can buy on Amazon that they would deem essential, as opposed to trying to get your new iPad, or try to get some, you know, like, I don't know, some new desk trinket or whatever, or, you know, necklace or wristwatch or something. I don't know, just whatever people buy on Amazon that they really don't need. So anyway, I'll finish off here with this section before I get into the articles. Definitely avoid anything at all that can risk any injury whatsoever. Anything. So if you enjoy performing activities for exercise or for any reason whatsoever, if you can avoid it at all possible, definitely do so, because if you hurt yourself, you're going to wind up in the hospital, where you're going to be highly susceptible to contracting this virus. And once you get fixed up in the hospital and you go back home, you might be spreading the virus to everybody you know. Hospitals are doing the best they can to isolate people who are infectious from the rest of the hospital. And that's why they deployed those naval medical ships, because they're not going to use those ships for infected individuals. They're going to use those ships for people who accidentally broke their leg, or somebody who had their appendix burst, or whatever. Whatever the case is, an acute injury or an acute illness, they want to try to push those people onto those ships to get their medical treatment, because then they can be assured that nobody on there has coronavirus, because I'm sure before they put them on those ships, they're going to put them through a test, and they're going to swab them, or whatever it is they're going to do before they put them on the ship for their medical treatment. So, and things that you should not do would include driving. And, you know, you just have to face reality. When you're driving your car, you could be involved in a traffic accident. It probably won't be your fault, but Nevertheless, if you're driving your car anywhere, even if you're driving down the street, if you don't have to, if you're just doing it just to take a Sunday drive because you've been cooped up all week, just have second thoughts on it, please. Because if you're driving around, you're just putting yourself at risk of getting injured, and you could wind up in a hospital where you might accidentally get infected. So, car accidents, they easily cause injuries. They really do. I mean, even fender benders, whiplash, whatever, you might, it might jostle you and freak you out. And you might insist on going to the hospital and put yourself at risk. Especially when you're in a situation like a car accident, you're not thinking clearly. You've just been shook up. You could be legitimately injured. Could have a busted lip or busted nose from the airbag, whatever it is. You might be freaked out to the point where you're like, I don't care. I got to go to the hospital because I'm clearly hurt here. So the best thing you can do is minimize your driving, because the more you drive, the more you put yourself at risk. And I know that there's people out there, they commute, an hour and a half to work, hour and a half from work on highways, interstates. And they've been doing so for 20 years, 25 years, and never been in an accident. Don't have that mindset, because no matter what, an accident can come out of nowhere, especially these days when people sit on their smartphones while they're driving, which is insane. And I absolutely don't do it because, first of all, I don't have a data plan on a smartphone. I do have a smartphone, but it's only used for Wi-Fi. The only phone that I have that has any connectivity to the rest of the world at all is a cheap flip phone that I paid like $15 for. And if you watched the video yesterday, I'm drawing a blank at the moment, but I did say what my carrier was. I pay like $6 a month for it, 100 minutes of talk per month, unlimited texting. And not only can I not use my phone while I'm driving, I also drive a stick shift. So if you have experience driving a stick shift, then you'll know what I'm talking about. It's not so easy to use a phone while you're operating a stick shift in stop and go traffic. So there's that. And another thing, definitely risk any activities, any fun activities that you might be inclined to do because you're bored, such as skateboarding, snowboarding, riding your bicycle, climbing. Or if you're at work, or if you want to get some work done around the house, try to avoid working on ladders, especially for extensive periods of time, and handling risky tools like a circular saw, for instance. Even doing something like parkour. Just use common sense. Do whatever you can to exercise your common sense, and just weigh the pros and cons here. Just think to yourself, okay, well, I really want to get up on the ladder and clean out the gutters because I'm bored to tears right now. I don't know what else to do, but this will shave 4 hours off of my day. But you have to weigh that with the risks. Well, should I get up on the ladder? What if I slip and fall? If I slip and fall, I could break my arm. Or if I fall, I'm going to hurt myself in some way or another, and I'll probably have to go to the hospital, which, by the way, is overrun with coronavirus. So just use common sense out there, people. Just when, I mean, I'm not saying don't go out and have fun. Don't go out and not just, I don't know, like wear knee pads, wear elbow pads, wear helmet. Like, just, if you have to go skateboarding no matter what, or if you really want to go ride your bike, just use your common sense. Just don't put yourself in a situation where it's risky in any way, shape, or form, because you don't want to end up at the hospital right now, for sure. Definitely don't want to. So, and I'll just finish on this. Ford and Tesla, they're making ventilators. That's pretty awesome. And there's another car manufacturer, but I briefly tried to find the third one. Those were the two that I knew offhand because I heard that last night. But there are a few auto manufacturers, including these two, that are switching from making cars to making ventilators, which is really cool. And again, like I said yesterday, if Elon Musk said that, you know what, I think today I'm going to start making ventilators. The world seems to need them. I think we can do it. Let's do it. Come on, folks. All right, come on, Tesla. Let's make some ventilators. I think they're going to be making some ventilators. They're going to be making lots of ventilators. So, and since Tesla is an American company, Elon Musk is here in the good old US of A. I think that if Elon Musk is on it, I think that is a really bright ray of sunshine that we need at this darkest hour, because people who get coronavirus, apparently ventilators, it's almost a necessity from what it sounds like. So that is some definite good news. But again, whatever you can do to prolong yourself from getting this disease, just please do so. The longer that you wait without contracting it, the better off you're going to be, because as the days wear on, more things are going to get shipped to hospitals, more supplies are going to get out there, more ventilators are going to be manufactured, more masks are going to be manufactured. The pharmaceutical companies are going to be closer and closer to better medications to mitigate this mess. So just hunker down, as long as you can. If you don't have all that much food, ration it. Just do whatever you can. Look at that as an opportunity to maybe lose some weight if you want to lose a little bit of weight. I mean, personally, I think I could use a little weight loss because I have a herniated disc in my back. So if I gain weight, it's gonna have a nasty effect on my back. So I always have to keep my weight at a certain level. But now I might have the opportunity to drop my weight a little bit even more if I just ration my food for a little bit, which will prolong your food supply. But just only go out if you have to. Don't go out because you're bored. Don't go out because you think you need a giant-sized Hershey bar because you're craving it. You know, don't use your cravings as an excuse to go out and expose yourself to the potential of what's out there. I mean, just hunker down. Use if you don't know what else to do, like if Netflix is boring, if you don't feel like watching movies, like TV, you're just bored with it, watch my previous video. I don't know at what point I was in the video when I discussed it, but there was an article that I was reading yesterday that was talking about different things and activities you can do. There's a number of gym websites, or not just websites, but gym companies like LA Fitness. Gold's Gym was one. They were offering their app for free for an extended period of time. And there's other, like, what was the other one? It was the theater, or Broadway, like Broadway plays and stuff. There's companies that put on these Broadway shows, and right now they're putting on these Broadway shows on an empty stage, and they're recording it, and they're offering these Broadway productions via YouTube or Netflix or other providers. Plus, the Hollywood industry, the movie industry, nobody's going to the movie theater anymore because I'm sure by now most of them are closed. So what they are doing like direct to streaming. So all the movies that were expected to hit theaters this weekend, and same with last weekend before, and as well as the ones that will be coming up over the next couple of weekends, they are in large part, not all of them, like the James Bond movie, for example, they pushed that back to November. They were being jerks. They weren't going to let us see that from home. But there are a lot of movies, especially kids' movies. Frozen 2, they named a couple of others. Frozen 2 is not in theaters, but it hit Disney Plus early because there's a lot of kids that are stuck at home. So, but yeah, definitely look at that. If you're eager to see one of these springtime movies that you were hoping to see in the theater, they are not, I can't really say in large part because I haven't looked at this because I don't really care about movie theaters personally, but if you were looking forward to seeing a movie, just do your research, Google it, because you might be able to watch it from home. Just be ready to pay a fairly high price for it, because there were some of these blockbuster style movies that they spent a lot of money on. If you want to watch it from home, when you should be watching it in the movie theater on opening weekend, they're charging like something like $20 just to stream it for, I don't know how long it is. Honestly, I don't know if it's only just for one viewing of it, or if you get like 24 hours access. Those of you who were alive long enough to remember the VHS Blockbuster videotape rental days, like Family Video and Blockbuster and VH1 Video and all those other little video stores where you can go there and you can rent a video cassette and you can go home and watch it all you want for 24 hours, but you got to make sure you have it back by stores closing. Otherwise, you're going to have to pay a fee. That was like $3 a day or something like that. I know that there's some platforms, I think YouTube does that, whenever you purchase a video on there. Not permanently purchase it, but if you purchase it to watch, no, hold on. I'm thinking pay-per-view. Pay-per-view does that. If you like old school pay-per-view, I mean, I am so old school. I'm telling you, I haven't subscribed to hardly anything. I have Amazon Prime, but I've never used their streaming service. But anyway, what I was saying was that, like, at least with pay-per-view, you could rent it and you get 24 hours, like unfettered access to it. For 24 hours, you can just watch it however much you want. Hopefully these movies that are hitting theaters, if you spend as much as $20 to watch this movie, hopefully they will at least give you 24 hours to enjoy it a couple of times. But I can't guarantee that because I honestly haven't looked. But if you have any extra information about that, definitely let me know in the comment section, especially when it comes to movie theater movies, because I just haven't done my due diligence to see what's going on. I usually wait till summer before I start probing for the good movies that are out there, as well as like Christmas time. I mean, the action movies are what I usually look for, or the like the big dramatic movies. That movie that's supposed to be coming out this, I think it's this summer, because they had a preview out for it. It was the new Christopher Nolan movie that's coming out. Some weird time travel movie. It looks insanely awesome. So yeah, I always look forward to the summer. They have some awesome movies in the summertime. But anyway, that's it. It's it for now. I believe I'm going to pause this. I will go on a little longer because I did pull up a number of articles. I'm going to pause this for a moment because it's a little bit past dinner time. I don't have any articles up here yet, but I will get them up here and I will go through them. And I guess I will stay tuned. And what you'll do, you will be magically thrusted forward in time, whether if it's 15 minutes or 30 minutes. And I will immediately start just like that, going right through the articles. So I will be back in just a moment, or in the flash of a second. All right, folks, I just finished having dinner, and I was watching Lingo once again with Chuck Woolery. And I am, honestly, after I was on a roll playing along, rather, I am kind of reluctant to finish up this video, but as promised, I will try to go through a few of these articles just as quickly as I can. At the very least, I will show you where I got these articles from, but I will go ahead and get started now. Let me see if I can do this. Okay, so X1, let me just show this real quick. The Johns Hopkins map for coronavirus right now. The numbers are getting high, they're getting scary, but you know, don't panic completely. There's 7 billion people on the earth right now. We're only at 304,000, so you know I know that it's still very bleak looking, especially when you're looking at the other locations, how quickly it's climbing. But let's just hope that we can curve this as quickly as we can, as soon as we can, and the map will hopefully peak in the coming days rather than weeks. So that's what we're looking at right now. Again, if you want to go on Google, and if you want to do a quick Google search, you can just type in Johns Hopkins map, and that will be the very first result you get, and you will get this map, which is the one that I found to be the most reliable, I suppose. I mean, every time I refresh it, the numbers adjust, so it looks like this one is a very reliable map, at least as far as what I found. If you found a map that's better than this, more accurate than this, you can always just leave a comment below, and I will check it out, and if that one proves to be more accurate, I'll go with that one from now on. So I will go into the next article right away here. Let me see, let me just start with number 2, and I'll go through those. So this one, and all of these were published today or yesterday. Looks like there were a couple that I caught at the tail end of yesterday. But this one was crazy. The French border guards, they seized 2 lorries carrying 130,000 coronavirus face masks for Hero NHS medics. So the way that they worded it, they were trying to say that France like really screwed up by doing this, but I think it was an honest mistake. They sparked a near diplomatic row by seizing 2 lorries carrying 130,000 face masks rather for the NHS. The cargo was being urgently ferried in a major boost for overstretched UK medics battling coronavirus. So there's a picture of them. They didn't seize it technically. I mean, it says that they impounded it, but they only did for a very short amount of time. They got officials on the phone, and then they noticed the miscommunication, so they let it go. But these face masks are on their way to the UK. They're probably there by now because this was published late yesterday. So, you know, there's just another picture there to show it. You know, and then there's some more information that's just detailing it. But the point being is that the UK got their supplies. France just panicked at a moment's notice, but they saw the mix-up and they got their supplies safe and sound. So I'll go ahead and move on to the next article here. And the next one is going to bring us to the FAA, who was briefly suspending all flights bound for New York City, all flights, and Philadelphia airports. Now, this might trickle down to your local area if you live in a major city or if you live in a city that has an international airport. You might start to see this popping up in your area in the next coming days. So that's mainly the reason why I wanted to highlight this article, because it's happening here. And from what we've noticed in days past, when something drastic happens, it starts to trickle down to other cities that are not as populated as cities like New York City in the United States, which is the most populated, obviously. So I will go ahead and move on to the next article. If you want, you can just go to USA Today and just Google this. Just use a few words out of the title and it will take you straight here and you can read it for yourself. And let me go ahead and move on to the next one here. That will be number 4. This looks like NBC. NBCnews.com, Illinois issues a stay-home order for 13 million residents. So this is not just happening in Chicago. This is also happening in, I believe, Los Angeles. I don't know if they've actually officially made Los Angeles a stay-home order city yet, but I know that it's happening in Sacramento and it's also happening in San Francisco. And obviously it's happening in New York City as well. So they are strongly urging people to stay in their homes. The only reason that they should have to be outside is to go get groceries, go get bare essentials, something that they're running out of, and staying out is as little as humanly possible. But hunker down if you're in these cities because they might be moving to start fining people, or if drastic measures are taken, maybe even jailing people. So let's hope we don't get that bad. But this is just an ominous sign of what's to come. So let's go ahead and move to the next article here. Moving on to number 5. In hard-hit areas, testing restricted to healthcare workers and hospital patients. And this is on Washington Post. So with this article, they're trying to reserve all the equipment to healthcare workers and the patients that are in the hospital, and that includes the N95 masks, as well as other equipment like ventilators. Obviously ventilators, because that's primarily in the hospital, but the testing that this article is speaking to is the testing for the coronavirus, period. So if you have like a sniffle, or if you think you might have something that you might think could be related to coronavirus, or related to the symptoms that they're telling you that would indicate that you have coronavirus, there are some hard-hit areas in the country where they may refuse a test to you because they're either in short supply, or they are trying to they're trying to put back a small reserve of tests for medical professionals who are in constant exposure to the coronavirus. And listen carefully, because if you have a number of doctors in your area and or nurses who are working around coronavirus constantly, and if they get exposed to it, they cannot do their jobs. They're going to be held up in their homes, and they're going to be suffering with coronavirus when they could be at work working really hard to try to keep this situation from getting worse. So they want to make sure that they have enough testing kits, not testing kits exactly, but individual tests that that they'll have on supply for healthcare workers and hospital patients. So if you're in a hard-hit area, expect that to happen. It may be coming in the coming days if you live in a major city. But again, this is on the WashingtonPost.com. And I don't believe I highlighted any of this, but yeah, it is important nevertheless. If you want to look up this article specifically, again, do a Google search, just take a couple of keywords out of this, type in Washington Post, and it'll pop right up if you want to learn more about it. We move on to the next article here. We're going to go over to CNN.com, which will bring us to, let's see, this U.S. coronavirus death toll hits 300 as more states urge residents to stay home. So it's getting worse day by day. CNN is emphasizing the fact that people are dying in the hundreds by now, not hundreds per day. We're not anywhere close to that yet, but the death toll across the United States hits 300. And the problem is that more people are dying per day, and it's only going to get higher and higher as the days go on. So definitely do everything you can to stay indoors. I mean, I've been talking about this in several videos now. Don't go out. Don't go to your grocery store if you have a stockpile of anything, even a few days worth of a stockpile. Whatever you have that you can use to keep yourself indoors, do not go out under any circumstance whatsoever. So let me skip out of that one and we'll jump straight to the next one, number 7 here. And this is from the Washington Examiner. Coronavirus testing is ramping up with 50,000 completed by Friday. So this is good news. This is good news that they are testing people. They're testing them quickly, and they're testing more and more per day. Now, I did mention in the previous article that I pulled up that in major cities, ones not just major cities necessarily, but cities that are hit really hard, such as New York City, let's see, Seattle, San Francisco, I think is ramping up a bit. Definitely Los Angeles is getting a big uptick, as well as Chicago. Some places that are hit especially hard, they may have a short supply for the short term. The White House and the president has informed us that they are ramping up supply for tests. So these articles, this isn't a long term issue here. This is only going to be for a couple of days. But there are a couple of hard hit areas like New York City and Seattle, for example, where if you wanted to go and just like if you have a stuffy nose and you just want to go, or runny nose, I don't know why I keep saying stuffy nose, but if you have a runny nose, or if you have like one symptom that could be related to coronavirus, and if you're in a hard hit area, they might say, well, look, just give it an extra day and come back tomorrow. If you have more worsening symptoms, if you have a fever, if you have, 2, 3 of the symptoms that you would have under coronavirus, maybe we'll test you now. But they are gearing up the supply. They are getting more tests available to different communities around the country. And it's just going to get better day after day, people. It's going to keep getting better in terms of testing, in terms of supply, in terms of the numbers. And hopefully you might be able to fend this virus off for another couple of weeks. And this is why they're stressing that you have to have a 2-week supply of food, or well, you shouldn't be stocking up your food at this point. You've already missed that boat. You should be sitting in your house. You should be just held up, and you should be consuming the 2 weeks worth of food that you should have already gathered at this point. Because imagine 2 weeks from now, it's just going to get worse. Every day that you watch my videos, or you watch any press conferences, or if you watch any videos, or if you read any articles or anything, you're going to see this day by day getting worse and worse and worse, meaning that more people are getting infected, which means it's more dangerous for you to go out there because you might end up contracting this thing. But they're hoping that if you have a 2-week supply of food at this point, again, I'm saying that you should be on day 2, maybe day 3 of this 14-day supply of food at this point, or even maybe more than that if you were prepared enough. Then you should be held up in your house and just wait a couple of weeks, because 2 weeks from now, it's still going to look pretty bad, but the amount of tests out there are going to be in the millions and millions of tests. So it should be really easy 2 weeks from now, hopefully, as long as the system is working as well as they claim it is. A couple of weeks from now, when you run out of your supply and you have to take the risk to go out and get more food, you're still going to be at a very high risk of getting coronavirus, but protect yourself the best way you can. But if you think you might get it, it's going to be way easier to get a test then as it will now. At least that's what the government's telling us. And I will say really quick, if you have to go to the grocery store, even if it's tomorrow or if it's a week from now, there is, I don't know, I wouldn't actually bank on this. This is just a personal common sense thought that I came up with, so I don't know if this is really effective, but I had to go to Ace Hardware today because I'm going to start working from home as early as Monday. Unfortunately, because of the red tape at my work, we have to have a fire extinguisher in our house for us to be able to work from home. So I had to go out to Ace Hardware today, the first store that I went to since last Friday, since day one. And by going there, I did some thinking and trying to prepare myself for the risk of going out and potentially brushing up with coronavirus itself. And what I did, I actually took out some pajama pants, and where I live right now, it's hot. It's like today's high was like 84 degrees. So it's wall to wall sunshine, and it's hot. It's kind of humid. So this was not comfortable for me at all. But I put on some long pants, pajama pants, and then I also put on a long sleeve shirt. And after I dressed myself to go out, by the way, before I go any further, I did have a pair of shorts, like a stretchy waist shorts, like cloth shorts on underneath, not boxers. I just had like a regular pair of plaid shorts underneath my pajama pants, and then I had a tank top, wife beater, or whatever you want to call it, underneath. And I went to Ace Hardware. I went right in there. Thank God there were only like 3 people in there shopping. So I think I was kind of over prepared for this. But I brought aerosol disinfectant spray. I brought some sanitary wipes, disinfectant wipes, and then I had hand sanitizer. So I was just ready just to go in there, grab what I had to get out of there as soon as possible. I knew how much it was going to cost because I calculated for taxes, and I gave them the exact amount. I got no change in return, and then I left right away with my fire extinguisher. And I went out to my car, I dropped the box in my trunk, and then I wiped it with sanitary wipes. And afterward, I had a trash bag that I brought with me that was laying in my trunk that I had opened before I left my house. And I took off my pajama pants, exposing these shorts, the plaid shorts that I had. Trust me, they're not boxers. These are like legit, shorts that I've actually worn these to work before. Um, and I turned my pajama pants inside out as I took them off, and I dropped them in the trash bag, and then I took off my long sleeve shirt, made sure it was inside out when I took it off, and I put it in the trash bag, and then I sealed up the trash bag, sanitized my hands, and tried to wipe my arms up a bit with the disinfecting wipes, and I hopped in the car, went home, and then when I got home, I took the fire extinguisher out of the box in case somebody else took it out before me, while I was still at the trunk of my car, and I wiped it down with disinfecting wipes. And then I took my sealed up bag and I set it on the front porch that had my clothes in it that I went into the store with. And I went inside. I immediately washed my face. I washed my hair. And I used liquid soap to wash my arms that went all the way up my arms up to about my shoulders. And I also used the disinfecting spray before I went into the house when I was still at the trunk. I actually forgot that part, but I sprayed down my shoes. So sounds OCD as hell. It sounds really overblown, but as much as I've been reading about this, it's better to be over prepared than just assume that nobody around you has it and just roll the dice, because that is not smart, especially when you live somebody who has lung issues such as myself, because I live with my mother, and she has lung issues. She is a full-time teacher, and I'm not going to tell you what grade, but she is a full-time school teacher. So she's dealing with all of that right now. So now is not the time for her to get sick, because she has a classroom of kids that she has to try to figure out how to teach without being in the classroom, because they're trying to do virtual teaching in the state of Florida, and they're supposed to start rolling out this program next week, which sounds like a nightmare, but they're going to try to do it. But anyway, if you go to the store, if you have to go to the store, I mean, it couldn't hurt, right? I mean, what I did when I put on the long sleeve shirt, or the long pants and everything, did it really protect me from the virus? I don't know, but I did the best I could to try to keep myself from getting infected while I was out. Because if I just wore just a pair of, board shorts and a tank top and just waltzed in there and got what I wanted and just went home, God knows what I would have had on my skin. I don't know. I just have to assume that there is something in there. There is a trace amount at the least of coronavirus in that store. So this is no joke, people. I mean, it's seriously no joke. You don't want to get this thing. I mean, this thing is a killer. It really is. I mean, it's killing people in their 20s and 30s. I mean, that's complete misinformation that it's only affecting senior citizens. It's absolutely not. It's taken the lives of people in almost all age groups, really. I mean, the only one that they're either underreporting or that hasn't been reported are kids, like elementary school kids. It seems like that they're either handling it really well or they've been incredibly lucky and they haven't gotten it yet. But anyway, let me go ahead and go to the next article here. That would take us, was it 8? Did I already click on that? No. So coronavirus confirmed cases have topped 300,000 worldwide. And also in this, which I've already covered, is Mike Pence and his wife. They both tested negative for the coronavirus. So the gist of this is that if you don't know how many people have tested positive for coronavirus, not nationwide in the United States, but worldwide, the article is informing you that it has gone north of 300,000. And when I brought up that Johns Hopkins number here, it's up to 304,000 as of right now. So it's climbing quickly. So let's go ahead and go to the next article here. Number 9, which is fastcompany.com. So when it comes to the bars of soaps and the liquid soap and everything I was talking about before, when I had my list of notes up, when I said I would mention where I got that information from, here you go. And it says that soap, whether it's all natural, handmade, liquid, bar, or foamy, it has a particularly molecular makeup made of what are actually called soap molecules. Soap molecules possess both hydrophobic, which is water averse, and hydrophilic, which is water attracting properties. When introduced to water, the water attracting parts of the tiny soap molecule point outward in, and then turn are able to dissolve fatty substances in liquids. This is why soap is so great for cleaning dishes. This is particularly special quality in a time where the culprit of COVID-19 is a coronavirus, which is a virus that is encased inside of a lipid, which is a fatty envelope. Soap is able to dissolve the protective coating around the virus, making it less capable of surviving, while rinsing your hands off with water after breaking down the virus's coat removes it from your skin completely. Okay, so you don't kill the virus outright with soap, but what you do when you wash your hands and you soak it up with soap suds and you get that soap all over you, you're removing its protective coating. And then once you dunk your hands underwater, there's nothing for the virus to connect to with the surface of your skin anymore, and it just flies right off. So that's why I wanted to emphasize this when it comes to bars of soap, because I was thinking, well, bars of soap, I don't think they're disinfectant, but it's not the disinfectant properties. It's the fact that it has soap molecules in it. So anything that's soap, any kind of soap, it will get coronavirus off of you as long as you wash off any place on your body where you think coronavirus may have attached itself to. And that includes if you go to the grocery store and you're breathing, if you just, walk past somebody who's exhaling coronavirus into the air, you're going to get those molecules all over your skin. So that's why I wore a long sleeve shirt and pajama pants, because if somebody walked past me and they breathed the virus onto me, it's going to stick on my clothes. It might get, if I'm unlucky enough, it might get on my face and my hair. Hopefully it wouldn't get into my nose, but I did the best I could. And when I came home, I took off those clothes, bagged them. As soon as I got out of the store, I did that. And then when I got home, I washed my face, my hair, and I hope that was good enough. But I don't know. I just have to hope for the best. So anyway, let's go on to the next article here. This is getting into Fox News. Spain's coronavirus cases leap by 5,000 in just 24 hours. Now they're only behind China and Italy, and this is actually not true. And I won't go any further with this because by this number here, it shows the United States worse off. Now we are number 3 in the entire world. The United States is 3rd on the planet for coronavirus cases. We have surpassed Spain. And in this article, which was published 10 hours ago, look at this, 10 hours ago, okay? It leaps by 5,000 in 24 hours, and they're saying that Spain is now 3rd in the world behind China and Italy. Well, sorry to disappoint, but it looks like the United States is now 3rd. And you see, just by a factor of, like 120 maybe? Like just by a little bit. It's looking like that the United States has surpassed Spain, but they're just saying that the number of cases in Spain had jumped by 5,000 in one day. So Spain was probably down, I don't know, like, 5th, 6th or something like that, but they spiked up real quick, and I'm sure that's not going to quit. I'm sure they're going to keep spiking upward. But the United States, it looks like that it's starting to spike upward, and now we're 3rd in the world, where Europe, they were getting nailed before we were. Remember when Iran, when they were getting hit hard, and Italy was getting hit really hard, and now Spain is starting to spike up, but they were dealing with that stuff a couple of weeks ago, Italy and Iran, when they were spiking up, and now the United States is already 3rd. So, if there's a reason to be nervous, if there's a reason to keep yourself inside, I hope that's good enough. The United States is already 3rd in the world for coronavirus cases. Now, it might just because of our rapid response to get tests out there, and now we're testing by the droves. Hopefully that's true. But otherwise, if it's not the number of tests that we're making available that's making that number go up necessarily, then I think we're in a world of trouble. But I really think that's the case. I think it's because we're rolling out hundreds of thousands of cases probably, or test kits, or tests, individual tests per day. They said tens of thousands of people are going to get tested per day. Eventually, that could roll up to 100,000 plus people per day. So and they've told us that in the past, that when these these tests become more and more available, like the drive-up tests and the walk-up tests in your local communities, once all of that starts funneling in to this overall number here, you're going to see a big uptick in the amount of people who are exposed. And that's occurring all over the place. So, yeah, it's I don't know. I hope this starts to slow down, hopefully soon. Let's see what number 11 has here for us. If you're sick during the coronavirus outbreak, when is it a good time to head to the doctor? And let me see. I think, is this No, I didn't have a list prepared for this. That must have been a different article. So, the symptoms of the novel coronavirus has been described to be familiar to the flu or a mild cold, leaving millions to wonder if their cough or scratchy throat are symptoms of COVID-19 or enough to warrant a visit to the doctor's office. Symptoms of COVID-19 include fever, cough, and shortness of breath, and may appear within 2 to 14 days after being exposed to the virus. So, what I was talking about earlier, if you think that you might have been exposed and you're not showing symptoms for like maybe 4 days and 5 days, and then you start, no, it looks like that you may, if you're exposed, you might not be able to start showing symptoms for 2 weeks after being exposed to the virus. That is extremely scary. I mean, that makes this, I don't know, probably 10 times more dangerous than the flu, if that's really true. Dangerous in terms of infection, not in terms of catching it necessarily, but still, this is a very dangerous thing we're dealing with. The human body has never dealt with this type of coronavirus before. That's why they keep calling it a novel coronavirus. Novel meaning that the human population has not been exposed to this before. So we don't have any vaccines for this. We don't have any preventative treatments for this in the way that we can curb your symptoms significantly. We don't have anything like that. We do for the flu, but we've been dealing with the flu for decades. And look where we are now. We're still losing thousands of people a year to the flu, just in our country alone. So, I mean, I'm not even prepared to think that far ahead right now with this. I mean, I think we should just get out of this nightmare as soon as possible. And the best thing we can do is stay inside. Stay inside, stay inside, stay inside. Don't get in contact with anybody. It's really hard to. We're a very social species, so I know it's difficult, but use FaceTime, use Facebook, use I don't know, like use whatever you need to use to get social with people, Skype, whatever. Let's see. So watch for. So one of the things you should watch for are gastrointestinal issues, and the symptoms for that would include diarrhea, vomiting, and abdominal pain. And they haven't been emphasizing that very much. This is like something that they're saying as far as an early symptom is concerned. If you think that maybe you were exposed to coronavirus, but you're not showing any symptoms, if you start to see symptoms like diarrhea, vomiting, and abdominal pain, then there is a chance you might have been exposed. But they're saying that this is an early symptom. Avoid running to your local emergency room if you just have a runny nose. Or you could at least call ahead to your doctor and describe your symptoms to them, and then you can get additional instructions on what to do if necessary, rather than just blindly going to the hospital because you think you have a runny nose, because they probably won't give you a test once they get there. They're trying to conserve these tests for people who they really think have it. So before you just run off to your emergency room, what you really should do is just get a hold of your doctor, tell them what's going on, and then they will be able to weigh the, just like weigh the difference, or just like, kind of make a determination whether or not if you should actually go and get tested. We're still in the flu season, so most likely it will be something other than coronavirus if you do have these symptoms. And it is coronavirus, and if it is coronavirus, it says it will be a mild illness, but I mean, I'm quoting somebody. I'm not actually seeing who I'm quoting here, but it looks like Dr. Jay Butler, CDC's Deputy Director for Infectious Diseases. And he's saying, in terms of people who get ill with respiratory illness, there are two thoughts, he said. We're still in the flu season, so most likely it will be something other than COVID-19, and if it is COVID-19, it will be a mild illness. Butler said to be aware of symptoms such as fever, shortness of breath, and tightness or fullness in the chest, but that when they develop, to call for help rather than rushing out the door. So there's that. And with that, I'll go straight to the next one here. Number 12. This is the final thing. Google has finally put their coronavirus website together, and this is it. This is the final product. And the White House has been talking about this. They said that there were 1,000 engineers that Google set aside to compile a website that will be one of the most helpful informational sites that you can access on the internet in terms of coronavirus. So if you want to learn what's going on as far as data and insights, if you need resources to help you, if you want to support relief efforts, so if you want to donate in any way. You can also read blog entries, I guess from Google's blog. It says from our blog. Also health information if you want the latest on like symptoms or what's going on with the virus as a whole. There's help and information here. There's cdc.gov. There's WHO.int, that's probably World Health Organization. And then they tell you how it spreads and some very vital information, but also short and to the point. Do the 5. Wash your hands often. Use your elbow to cough into it. And your face, do not touch it. And keep a safe distance from people and stay home if you can. Do the 5. So, and then there's other safety and prevention tips here. There's definitely videos you can watch. I'm sure, yeah, see their YouTube. They have YouTube logos on them, so it'll put you straight through to YouTube to watch those videos. There's some data and insights, so you can find out some numbers. Probably, yeah, see country by country. And you can also get coronavirus search trends and find out what's most popular under Google Trends. Then there's some resources you can use to help. Or use for help. You can get coping techniques for stressful days. You can get pantry meals. So if you stockpiled canned goods and dry foods and all that stuff, you can go here to get some recipes that might help spice up all of those survival foods that you stocked away. You can also work out. You can try and eat healthy, I guess, as best as you can. So yeah, so there's some good resources here. It's really good. It's definitely good. More resources from Google, just some additional information. Move in your classroom online, keep your business running, stay connected and informed with what's going on. And then you can support global relief efforts, and that's another thing here. And then they have a blog section where you can read the latest from their blog, which includes search terms, it includes education, it also includes company announcements. So this is the site that they were communicating with the White House that they were going to put out. The only thing that I'm not seeing here, which I'm sure it's right in front of me, they did say that there is a section up here that you can actually take like a click-by-click test if you think that you're sick, that it's supposed to take you through like a step-by-step process, like, do you have this? And if you click yes or click no. If I don't have this, then it'll take you a different way. If I do have this, then you're still on that track that you might have it, or whatever the case might be. But I'm not seeing that. I'm sure it's here somewhere. I'm just not looking closely because I'm just rolling through this real quick because I know this video has gone on really long. But that's about all I have right now. So that's it for Saturday. And if you have any resources that I should share with everybody, if you found any crazy articles out there that I'm not covering, if you're in an area where you're seeing a giant impact, definitely, whatever it is, just share it in the comments because I read these comments. So just definitely let me know if you've seen anything, if you think that I should be talking about anything, no matter how big or small. If somebody is reaching out to me through the comments and they think that whatever they have to say is important, I'll read your comment and I'll talk about it, especially if it's important. So definitely use the comments to that advantage because I will read them. And I guess for now, that's basically it. And I hope everybody stays safe out there. Hopefully our world won't become a place like this where it's winter time on the surface, like a permanent winter, and then we're resorting to living in underground cities that go down into the nice warmth below. But yeah, in the next video, I will post the next video hopefully on Sunday tomorrow. I will try to get this video out tonight, but usually when I'm done with this stuff, it's usually like 9 o'clock, 10 o'clock at night. When I finish the video, I have to run it through my video editor, which takes about an hour. And by that time, I have to get up at 5:30 in the morning. So my sincerest apologies. It's really hard for me to get these videos up the night that I put them out. But I will try to see if I can work my schedule to start getting these things out right before I go to bed. But I'm just doing the best I can. And anyway, again, I hope you stay safe out there. Hope you take care of yourself. Stay away from the public at all possible. Even if you have just cans of beans in your closet, just do whatever you can. This is a survival situation. You don't want to get coronavirus. Whatever you have to eat in your house, just make sure it is all gone before you even take that risk, because it is not worth it as long as you still have food in your house. So until tomorrow, I guess I will cut it here and stay extra safe out there, people. Thank you for watching.